I would say every day in the office here at Caring Medical in Oak Park we see impingement syndrome. The classic impingement syndrome is that the rotator cuff, which moves the shoulder, is getting pinched typically by a bone spur. So that's the classic. When the person internally rotates their arm, the rotator cuff, one of the tendons, gets pinched. It's normally the supraspinatus tendon. But realize there's an impingement syndrome also in the hip. So I would say every day at Caring Medical we see this. The amount of surgeries that have been needed on our patients in the course of 18 years that I've been here has been very few. There is times, like I tell folks, if they do have impingement syndrome, most of the time the impingement syndrome is because the body overgrew bone. So in the shoulder, it's the body overgrows bone in the acromioclavicular joint. And then there's like a bone spur, an overgrowth of bone that's pinching on the rotator cuff tendon. That the body overgrew that bone. Why? Because the acromioclavicular ligament, the acromioclavicular joint, became unstable. And this is the main point of this video, is that prolotherapy gets at the genesis of the problem. So genesis means the beginning. So how did the acromioclavicular joint get unstable? It got unstable because there was a ligament injury. So prolotherapy, by strengthening the acromioclavicular ligament, will stabilize that joint. So then there's no more reason the body has that bone spur. And the body over time will reabsorb that bone spur. And then if we need to, I can inject some Novocaine, which is acidic. You know, that's what we use to try to sort of speed up the bone spur reabsorption, so we can do that. I'm not saying every single time it's successful, but a lot of people, if we get them to the point often that they can do everything they want except they have a little bit of discomfort with overhead activity. So in other words, it may take some time for the body to reabsorb that bone spur. So as long as you're a little bit patient, and so in other words, prolotherapy gets at 90% of the pain. Then they got a little bit of pain like when they're painting. So if the person gets to that point and they're impatient and they want to get the rest of the bone spur shaved, they'll get it shaved. But most of our clients, they're really content with no, doc, I'm happy, and and then they just won't do lap pull downs. But having said that, though, often we'll get rid of all the pain. So you could say, well, geez, doc, how, if there's a bone spur there and and there's this impingement syndrome, something's getting pinched, like how does prolotherapy get rid of it? Well, prolotherapy gets rid of it because at the time we're not only stabilizing the acromioclavicular joint or the hip joint, but we're stabilizing the glenohumeral joint. So sometimes the impingement is from instability of the big joint. The big joint, the big shoulder joint. The top of the shoulder, which is the acromioclavicular joint, is really a little joint. The big shoulder joint, the ball and socket joint in the hip, and the ball kind of in a socket in the shoulder. Prolotherapy, by stabilizing that joint, then you won't have excessive motion. And often it's that excessive motion, boom, that's pinching the tendon. It's the excessive motion. So I think that's where maybe a prolotherapy doctor differs from an orthopedic surgeon, because they want to do surgery on any kind of impingement of the hip or impingement of the shoulder. But I am a strong advocate. You always should try more conservative treatments than surgery, because I see a lot of surgical failures. So surgery can do miraculous things, but once you do surgery, man, you can't really go back. So I'd really encourage folks, first try prolotherapy. There's a very good chance, 85% chance at least, if not getting all the pain gone, the majority of the pain gone. And hopefully then, you avoid a surgical procedure. Usually we see people 3-6 visits, something like that. So you got to figure the average person's 4 or 5 visits. So that's the bad part of prolotherapy. But you can train while you get prolotherapy, and often for impingement syndrome of the hip or the shoulder, it works fabulous.